What if I told you that the exact way most owners in this country check their dog for ticks after a summer walk is actually letting the most dangerous ones slip through completely undetected? Every single evening in vet clinics across the United States, dogs are walking through the door carrying an 8-legged passenger the owner swore was not there. A passenger that can trigger a vet bill of $800 to $2,000 for a disease that a 2-minute ritual, done every single time, would have caught for free. And the tools you need are already sitting in your kitchen drawer, your bathroom cabinet, and on the palms of your own hands. Did you know that a nymph tick, the stage most likely to transmit Lyme disease to your dog, is roughly the size of a single poppy seed? That is the whole problem right there. You think you are looking for a bug. Your enemy is a dot. If you saw the thumbnail of this video, you saw the promise. Today I am going to walk you through, in exact order, the 2-minute check that every single one of my longtime patients does after every single walk from spring through late fall. This is the routine that has kept my own personal patients Lyme negative for years, while their neighbors are getting phone calls no one wants to get. Hello everyone, I am Dr. Ray Carter, canine specialist veterinarian, and welcome back to the channel. In my clinic, tick prevention is the #1 seasonal question owners ask me, right after the summer heat question we covered in a previous video on cooling your dog down safely. And I am going to be honest with you. Most of what people are doing when they check for ticks looks thorough, but misses the exact places ticks actually attach. Take a deep breath and drop the guilt at the door. You are not a bad pet parent. Nobody teaches you this. The pet store did not teach you this. The breeder did not teach you this. And even the trail signs at your favorite park just say, check your dog, without ever telling you how. So today, we are going to do a full masterclass on the 2-minute tick check. Grab a notebook, tap that subscribe button, and let us begin. Chapter number 1, the 3-phase ritual that turns a random pat down into a real check. Here's the science, and it is simpler than you think. A tick that has just hitched a ride on your dog is called questing. It is walking. It has not attached its mouth parts to the skin yet. In this walking phase, which usually lasts between 15 minutes and 2 hours after your dog first picks it up, the tick is completely removable with your fingers in one gentle motion with zero risk of disease transmission. This is your window. This is the golden gap between a walk in the park and a diagnosis in my office. Real-world example. A patient of mine, a 5-year-old golden retriever named Biscuit, came in last September after her owner noticed a small black bump behind her ear. That bump had already been feeding for about 36 hours. 2 weeks later, Biscuit tested positive for anaplasmosis. Biscuit is doing wonderfully today, but her owner told me something I will never forget. She said, "I checked her that night. I swear I did." And she had. She had run her hands over Biscuit's back and sides, but she had never once touched the inside of her ear, the space between her toes, or the fold of her armpit. And that, my friends, is where 9 out of 10 ticks decide to sit down for dinner. The correct way, think of the check as 3 phases in a fixed order. Phase 1, the palm sweep. Phase 2, the hot zone map. Phase 3, the removal window. Every single one of those phases has a purpose, and skipping any one of them is like locking 2 of the 3 doors of your house at night. Instruction: set a 2-minute timer on your phone the moment you unclip the leash at the door. 2 minutes, that is the whole budget. Anything less and you are rushing. Anything more and your dog is going to walk away from you halfway through, which brings us to the budget trick of this whole system. The budget trick: do the check on the exact same rug or towel every time, right by the door. Your dog learns that the rug means a gentle massage, not a wrestling match. Cost of the rug: a $10 bath towel from any store, or $0 if you already own one. That is your entire equipment budget for a routine that saves you hundreds in vet bills. And one important note before we move on. Never, ever run this check outside in the yard. Ticks that are still questing can drop off your dog and into your grass, and now you have a colony sitting exactly where your dog plays. Do the check inside, on a hard floor or a light-colored towel, where a dropped tick has nowhere to hide. Chapter number 2, Phase 1, the palm sweep, which is where your hands become the world's most sensitive tick detector. Here is the fascinating truth. Your fingertips can feel a bump smaller than your eyes can see. In dermatology, this is called tactile discrimination, and it is why a doctor can find a lump on a dog covered in thick black fur in half the time it takes to visually scan the same dog. Your hands are already better at this job than your eyes. Would you have guessed that? Real-world example. I once found an engorged tick on a Great Dane in my clinic in about 11 seconds without ever looking down at the coat. His owner was stunned, but all I did was slow my hands down. That is the whole secret. The correct way: run flat, warm palms slowly from the tip of the nose all the way back to the base of the tail in long, continuous strokes, going with the direction of the fur and then against it. What are you feeling for? Anything that does not feel like skin, a tiny raised dot, a bump the size of a grain of sand, a firmness where the skin should be soft. Any bump gets a second look with your eyes. Instruction: your hands move at the speed of a slow massage, not a quick pet. Count silently to 20 as you go from head to tail on one side, 20 on the other side. That is 40 seconds of your 2-minute budget, and it is the single most important 40 seconds of the whole ritual. The budget trick: put on a pair of thin nitrile gloves from the drugstore, about $8 for a box of 100. Or use no gloves at all if your hands are freshly washed. Gloves actually make you more sensitive to bumps because they remove the tiny distractions of temperature and hair. Owners with long fingernails, please trim them for this. Nails miss bumps that fingertip pads catch. I promise you, once you feel your first questing tick under your palm, you will never trust a visual-only check again. Chapter number 3, Phase 2, the hot zone map, which is the difference between a good owner and a great one. Ticks are not stupid. They pick spots on your dog where the skin is thin, the fur is thin, and the blood is close to the surface. If you were a tick, would you not pick the same 7 neighborhoods every time? Understanding those 7 neighborhoods is your entire visual check. Neighborhood 1, the ears. The inside flap, the base where the ear meets the head, and the ear canal opening. Ticks love the ear because the skin here is paper thin and warm. Lift each ear gently, look at the underside, and run your fingertip along the base. Neighborhood 2, the eyelids and the muzzle folds. This is a shocker for most owners. Ticks will attach right on the upper eyelid, on the bridge of the nose, or in the whisker area, because your dog cannot easily scratch there. Neighborhood 3, the neck under the collar. Take the collar off, just take it off. A tick can hide under a collar for days undetected, and you will find nothing until the collar comes off for a bath, and by then, it is fully engorged. Neighborhood 4, the armpits. Lift the front leg. Look at that little pocket where the leg meets the chest. Thin skin, warm, dark, and almost never inspected. A tick paradise. Neighborhood 5, between the toes. Spread each pad gently. A tick between the toes causes limping and constant licking, and owners often bring the dog in thinking it is an allergy or a splinter. Neighborhood 6, the groin and the belly. Flip the dog onto their back for a belly rub, because a belly rub is really a tick check in disguise. The inner thighs, the groin, and the belly are almost hairless. This is prime real estate. Neighborhood 7, the base of the tail and the anal area. I know, nobody wants to check there, but this is the second most common attachment site I see in my clinic. Gentle lift of the tail, quick visual, done. Instruction: your visual check goes ear, eye, neck, armpit, toe, belly, tail base, in that exact order. every single time. Order matters because your brain remembers order, and a memorized order means no skipped zone. The budget trick: use the flashlight on your phone, free, $0. The flashlight makes a tick pop out against fur that would otherwise camouflage it completely. If your dog has a very dark coat, a small fine-tooth comb, about $6, run through the coat lifts the fur just enough to expose the skin. Both are optional. The palms and the phone light are enough. Vet warning: I need everyone to pay very close attention to this next part, because this is where I see owners get hurt, and it is completely avoidable. Never ever poke your finger into your dog's ear canal or deep into a fold to try to feel for a tick. A dog that is startled by a poke can whip their head around and catch your fingertip with a tooth, and I have stitched up more than one owner in my clinic for exactly this reason. Visual only in the deep folds and the ear canal. Hands stay on the surface. Chapter number 4. What a tick actually looks like at every stage, so you finally stop calling every dark bump a tick. Have you actually ever seen a tick before it attaches, up close? Most owners have not. What they picture is the science class drawing, a big brown balloon with legs. And that image, my friends, is the last stage, the engorged adult, the one you desperately want to catch before, not after. The correct way to identify a questing tick, the one walking on your dog, is dark brown or black, flat as a piece of paper, and about the size of a sesame seed to a small pumpkin seed, depending on the species. A nymph tick, the most dangerous stage for disease transmission, is the size of a single poppy seed. Yes, that small. An attached but not yet feeding tick looks like a tiny mole, a small flat bead pressed into the skin, and the engorged tick, the one that has been feeding for 24 to 48 hours, looks like a smooth gray or bluish balloon the size of a small pea with 8 tiny legs at the base. Real-world example: an owner in my clinic last spring brought in her poodle mix, convinced there were 3 ticks on his belly. All 3 were actually dark skin tags. That happens all the time. The reverse also happens. Another owner missed what she called a piece of dirt for an entire week, and that piece of dirt was a fully engorged deer tick. Instruction: if you are not sure whether the bump is a tick, a skin tag, or a scab, do the leg test. Look closely. A tick has 8 legs at the base where it meets the skin, and those legs move if you look for a full 10 seconds. A skin tag has no legs, ever. A scab has no legs, and often has a slight color change around it. The budget trick: keep a magnifying glass from the dollar store, $1, in the drawer with the tick tool. For a nymph tick, the magnifying glass is a game changer. Or use the zoom on your phone camera, which is absolutely free and gets you a photograph you can send me or your vet. If you saw the thumbnail of this video saying catch them before they dig in, this is exactly what I meant. The dig-in phase, the mouth part sinking in, happens somewhere between 15 minutes and 2 hours after your dog first picks up the tick. That is the entire reason the check is done immediately after every walk. Not at bedtime, not tomorrow morning, right now, at the door. That is the whole promise of this masterclass. And everything else in this video exists to protect that window. Chapter number 5, the correct removal technique so you finally stop making the tick worse. Here is the science. When a tick bites, it inserts a barbed mouth part and injects a cement-like saliva that glues it in place. What happens when you squeeze the body of an attached tick? You physically push bacteria and viruses from the tick's stomach back into your dog's bloodstream. That is how many tick-borne diseases actually transmit. Not from the bite itself, from the panic removal. Real-world example. I had a wonderful client last year who removed a tick with her fingernails, pinching from the top and twisting. She did what she thought was right, but she squeezed the abdomen. Her Labrador tested positive for ehrlichiosis 11 days later. She is not a bad owner. She is a brilliant owner. Nobody had ever shown her the correct way. The correct way: use a fine-tipped tweezer or a purpose-built tick key. Grip the tick as close to the skin as possible, right at the mouth parts, not the body. Then pull straight up, slow, steady, and firm. No twisting, no jerking, no squeezing. The tick releases in about 3 to 7 seconds if your grip is right. Instruction: fine-tip tweezers, about $12 at any drugstore. A dedicated plastic tick key, about $6, which slides under the tick and lifts it out in one motion. Both work. At least one of them belongs in your first aid kit. If the head breaks off and stays in the skin, leave it alone. Your dog's immune system will push it out in a few days, just like a splinter. Digging for it causes infection 10 times out of 10. The budget trick: fine-tip tweezers cost around $12 at any drugstore and are the safest fallback. A plastic tick key is about $6 and clips to a keychain. Keep one there so you always have it. If you are truly without any tool, use your thumb and forefinger placed as close to the skin as possible. Grip the mouth parts, not the body, and pull straight up with slow, steady pressure. Do not improvise with dental floss, sewing thread, or any other string. Looping string around a tick risks compressing its body and triggering a gut contents dump into the wound. It is not a recognized veterinary removal technique, and any loose strand within reach of your dog is a swallowing hazard. Swallowed string or floss can anchor in the gut and fold the intestine on itself, requiring emergency surgery. Vet warning: this is the second big warning of the video, so listen carefully. If your dog reacts with sudden pain, swelling, or a small bloody bump around the bite site in the first 24 hours, that is normal. But if that bump grows to the size of a quarter, becomes hot to the touch, or your dog spikes a fever, starts limping on multiple legs, or refuses food for more than one meal in the days that follow, that is not normal. Call your veterinarian that same day. Do not wait. Some tick-borne diseases move very fast in the first week, and early treatment can be the difference between a full recovery and a lifetime condition. Chapter number 6. The 5 removal myths that are still floating around every single dog park and why they turn a small problem into a big one. If you saw the thumbnail of this video, this chapter is where that promise gets stress tested. All 5 of these myths are removal habits that can undo the window you protected with the 2-minute check. All 5 of these myths are attempts to make the tick back out on its own after it has already dug in. Every single one of them makes the tick vomit into your dog before it detaches, which is the exact opposite of what you want. Does that not sound backwards? Myth number 1, the burning match. Someone always says to hold a hot match to the back of the tick. Please do not do this. You will burn your dog's skin, you will spook a scared tick into a full stomach dump, and you are one flinch away from setting your dog's coat on fire. Myth number 2, the nail polish suffocation. The theory is that nail polish smothers the tick and makes it back out. What actually happens? The tick suffocates slowly over hours, panics, and dumps its stomach contents into the wound the entire time. Myth number 3, the alcohol drop. Same principle, same result. A drop of alcohol on an attached tick stresses it, and a stressed tick regurgitates. Myth number 4, the petroleum jelly smother. Same story. Slow suffocation, panic vomit, worst case delivery of every bacteria the tick was carrying. Myth number 5, the sharp twist. This one comes from an old wives' tale that ticks screw themselves in one direction, so if you twist the other way, they unscrew. They do not screw in, they stab in. Twisting rips the mouth parts and squeezes the body at the same time. It is the worst possible motion. The correct way, as we already covered, is simple, boring, and absolutely correct. Fine-tipped tweezer or tick key, grip at the mouth parts, pull straight up. Instruction: If you already have any of these products in your medicine cabinet from a well-meaning aunt, throw them out for tick use tonight. Keep the alcohol for cleaning the wound after removal, which is what it is actually good for. But Dr. Carter, you might be thinking, what about the essential oil hacks I saw online? Let me be honest with you. Peppermint, eucalyptus, tea tree, clove, pennyroyal, all of these have been sold as tick repellents. Tea tree and pennyroyal are actively toxic to dogs, but so are eucalyptus and clove essential oils. Eucalyptus oil is absorbed through the skin and can cause drooling, vomiting, weakness, and in severe cases, seizures. Clove oil contains eugenol, which dogs metabolize poorly. Repeated skin exposure can cause liver damage. Peppermint is the least dangerous of the group, but still unreliable as a repellent. None of these work consistently, and several carry real toxicity risk. Please, no essential oils applied directly to your dog for tick control. If a home remedy is worth the risk, and this one is not, your veterinarian will know. Chapter number 7. The after removal ritual, so a small win today does not become a scary mystery next month. Here is the truth, and it is almost always skipped. You pulled the tick out. Now what? 95% of owners flush it, and in that single moment they throw away the most valuable piece of medical evidence in the entire event. The correct way: drop the tick into a small Ziploc bag or a small jar with a screw lid, along with a small square of moist paper towel to keep it from drying out. Write the date and where you were walking on the outside of the bag with a permanent marker. Put it in the freezer. If your dog develops any symptoms in the next 30 to 60 days, that tick can be identified by your vet or sent to a lab for species and disease testing for around $50. Real-world example. An owner in my clinic saved the tick her Cocker Spaniel picked up in July. 6 weeks later, her dog started limping. The tick, still frozen, was identified as a Lone Star tick, which pointed us straight to the correct treatment protocol on day 1 instead of week 3. That is an incredible saved timeline. Instruction: clean the bite site with a small amount of rubbing alcohol on a piece of clean gauze or a soft cloth or plain soap and water. Dispose of the gauze or cloth immediately in a closed trash container. Do not leave any used materials where your dog can grab and swallow them. Do not apply human triple antibiotic ointment to a tick bite site. Dogs will lick the wound and ingest the ointment. Some formulas contain the additive pramoxine, and the antibiotic component neomycin can trigger allergic reactions or GI upset in dogs when swallowed. Let the cleaned site air dry without any topical product. If you are concerned about infection at the bite site, call your veterinarian for a dog-safe recommendation. The budget trick: use a small snack-sized Ziploc, less than 3 cents each in a box of 100, or a repurposed pill bottle from your own medicine cabinet, $0. The freezer costs you nothing. This is the highest return on investment step in the entire video. And keep an eye on the bite site for a full 3 weeks. 90% of the time it heals into a tiny scab and disappears. If it grows into a target-shaped red ring, sometimes called a bullseye rash, that is a classic sign to call your vet, though dogs show this less clearly than humans. Any of the symptoms we mentioned earlier, fever, limping, appetite loss, mean a vet call the same day. Chapter number 8, the prevention layer, so the check becomes a rare event instead of a nightly emergency. The 2-minute check is the last line of defense, not the first. Would it not be better if that check almost never found anything at all? The first line of defense is your yard, your walking routes, and your monthly prevention product. Let me walk you through the 3-tier defense system that I recommend to every single new puppy owner in my clinic. Tier 1, the environment.